It's a minimally invasive fusion of the facet joint. The facet joint is a small joint in the posterior part of the spine, behind the spinal cord and nerve roots. And these joints become arthritic from time to time, and when those joints become arthritic, they can be very painful. Arthritis isn't always painful, but when it becomes very painful, there are a number of procedures that can be helpful. This procedure is one of the procedures that we sometimes use to treat pain in the facet joint. It involves drilling a small hole in the middle of the joint and placing a small piece of bone in that cylindrical hole and stabilizing the joint, eventually fusing it. It's a very small incision. It's less than a ½ inch, generally 2 stitches, and it heals up very quickly. We take the stitches out a few days later. This is best suited for somebody who has pain that's isolated to the joints, not pain that's generalized in the spine, not pain that is involving nerve roots or discs. If the pain is very specifically from these joints in the back part of the spine, this can be a very good procedure. We try not to do it on very young people. Very young people in general don't have this problem. This is a problem that happens to those of us who are advancing in age somewhat and whose spines are deteriorating normally and who have pain in those little joints.